part of the equation in terms of how we're going to overcome Stelara loss of exclusivity next year. In addition to the great performance out of Darzalex, which is actually gaining share as approvals over the last few years have moved that up in the course of treatment. So we're now hitting newly diagnosed patients where maybe 3 or 4 years ago it was more for third and fourth line setting. But we've got a stable of products that are coming, and we had 5 approvals in the quarter addressing serious disease states like bladder cancer, lung cancer, multiple myeloma, as well as inflammatory disease such as ulcerative colitis. That gives us 16 approvals this year across the globe for either new products or new indications. That really positions us extremely well, in addition to the great performance of the Darzalex, where we'll be able to overcome the Stelara loss of exclusivity. There's only been one company that has had a growth in the year in which there's been a major product be subject to loss of exclusivity, and that was Johnson Johnson back in 2018 with Remicade. We plan to do the same thing in 2025.
And let's talk a little bit about some of the specific numbers here, because you beat by 23 cents today. You had a 10-cent raise. So, I mean, 23 cents, obviously more than 10 cents there. When it comes to that 10 cents raise, I mean, the fact that it's maybe a little bit milder relative to some expectations, does that relate to Stelara destocking, for example, or is that some other component?
No, it's actually, there's a good news story there. So when you take in foreign currency change, the 23 is probably more equivalent to a 15-cent raise overall in the longer-term outlook. But the differential, and it's a really good question on your part, the differential is we intend to invest in the fourth quarter to continue accelerating this robust pipeline that we have. We did benefit in the quarter from a monetization of a royalty agreement we had. Somebody bought out the royalty we had rights to for a liver drug. We're going to take that unexpected income and move that towards investment for R&D. We're very proud while we were able to improve operating margins, it wasn't at the expense of our R&D investment. In fact, when you take out the acquisition costs that were included in the quarter, and by the way, the quarter was an all-time high for R&D investment, but even when you take out that one-time payment, we still, on a percent to sales basis, invested more heavily than we did last year at this time. So we continue to prioritize that next available dollar towards that innovation investment that will not only project well for the coming quarters, but quite frankly, the coming years.
Joe, as you said, no other company has ever grown revenue for a drug that's gone off patent other than Johnson & Johnson. And you expect to do that with Stelara as well next year. How do you plan on achieving that? I mean, do you have a playbook from last time? Is it about marketing? What's the solution?
Yeah, so with all due respect to my commercial colleagues who are fantastic at what they do, it really is about planning for the future. And Matt, you've heard us say before, we think in terms of not the next 2 quarters, but really the next 2 decades. And when you can invest in innovation, it puts you in a very distinct advantage. We're fortunate in our industry in that we don't wake up one morning and say, oh my gosh, we've lost a patent on something. We've got years to plan. So when we saw Stelara loss of exclusivity on the horizon, we started investing in this pipeline in 2017, 2018. So you need that kind of time horizon in order to plan. And we have just as we have more robust portfolio today in the pipeline than we did when we encountered the Remicade loss of exclusivity.
I wonder about, you've obviously spun off your consumer health business. GlaxoSmithKline did as well. Sanofi wants to do that, which tells me that the pharma business doesn't necessarily sit well under the same roof as other businesses. And yet, you have devices, and you continue to add to that business with deals. Do you see those 2 units staying together?
We do, Matt. If you think about where our long-term success will be, it's going to be by having a top-tier pharmaceutical business that investors prefer and a top-tier medical technology company that investors prefer. But we're starting to see kind of the convergence of both segments coming together. We've got a great offering now. It's a targeted release system for bladder cancer drugs. It's a pretzel-like device that sits on the bladder. There's less side effects, and it's actually much more efficacious. 84% overall survival or response rate in some recent studies. That is using a device technology to apply the cancer drug to the tumor itself that sits on top of the bladder. Those are the type of technologies that we think Johnson & Johnson is uniquely positioned to benefit from down the road, not just for patients, but for our business. But make no mistake about it, that is not where we're looking to be successful or where our success will reside in the next 5 or 10 years. It's making sure we continue to innovate in pharmaceuticals, innovating in medical technology.
Let's talk a little bit more about deals, of course, because you've made several of them over the past few years. You told Bloomberg in an interview that you're still seeking those smaller tuck-in deals that offer good value. You're open to larger acquisitions. I'd love to get just a little bit more detail here. I mean, what is the anatomy of what would be an attractive deal for you at this point? And would it be in pharma or devices, for example?
Yeah, and that's kind of the nice part of the answer is it depends, right? So when we look at kind of the criteria, we want to make sure there's a strategic purpose, a strategic fit to our business. So why is that asset worth more to us than it may be where it currently resides? Do we have a scientific expertise, a commercial capability? Maybe it is global reach. And if that standard is met, then we go on to the remaining 20% of the discussion with our board, and that's, does it create value and compensate shareholders for the risk that we're bearing on their behalf? You know, we've deployed about $36 billion in capital over the last 20 months. 2 of those deals required about $30 billion of that capital. Where investors get most excited is actually the balance from 30 to 36 billion, whereby we had 75 deals in that mix. That's where we have the opportunity to create the greatest value. We're not averse to doing larger scale deals, as we've obviously demonstrated, but those tuck-ins work really well, especially when we have clinical expertise that can kind of see not just around the first corner, but a couple corners to figure out what best solutions may reside for patients down the road.
And Joe, we only have 2 minutes left with you, and we're going to try really hard to squeeze in 2 questions. So here we go. Let's talk about Talc, for example, because you've, of course, this has been a long-running thing trying to address that litigation. We know that a federal bankruptcy judge in Texas said that he'll keep that handling in his own court. Of course, New Jersey, you haven't had such good luck there when it comes to the appeals court there. Do you think that you'll fare better in Texas and maybe finally get this wrapped up?
Yeah, well, we do. If you think about the bankruptcy law we're trying to target and hone in on, which precedent law would suggest should stay intact, it's providing maximum recovery for claimants on an otherwise, while preserving an otherwise viable business. That is exactly what we're trying to do with this offer. And in fact, this offer is supported by 83% of the claimants. We are providing them with their best recourse opportunity. If you just took the number of cases alone, it would take 2,500 years to adjudicate in the courts. There are some holdouts, but those holdouts personally gain financially by holding out. So we think this is a good combination. Make no mistake, while we want this responsibly behind us, J&J is still in a position with $14 billion of free cash flow to continue to invest for the long term, and these payouts will happen over a number of years.
I just want to ask about the election. Obviously, 3 weeks from today, we're going to talk to Donald Trump today at noon. Does it matter to Johnson & Johnson with regards to IRA changes, potentially?
So, Matt, we've been around for about 138 years, 23 different administrations. We're going to continue, whoever wins, to work on science that changes the game for healthcare. And Johnson & Johnson, quite frankly, doesn't have a vote, but the tens of thousands of employees that work for Johnson & Johnson based in the U.S. do. Some of the things we consider, though, when we look at what's important to our business is tax policy. We do think that the 21% is the fair share rate that exists today. We've been able to invest more in our business and create more jobs in the U.S. The other piece I would say is over-regulation or misguided regulation. We think the Inflation Reduction Act will limit innovation. Will there be a scaling back of the $500 billion that the industry invests on an annual basis to bring better science for better healthcare and better living?